Hello and welcome to Interview Channel. Today, we're going to cover 25 essential interview questions and top sample answers for pharmacy assistant positions, especially useful for freshers. Let's dive in. Question 1. What motivated you to pursue a career as a pharmacy assistant? Sample answer. My passion for healthcare and desire to help people led me to pursue a career as a pharmacy assistant. I'm fascinated by the science behind medications and their impact on patients' lives. As a pharmacy assistant, I can combine my interest in healthcare with my strong organizational and customer service skills to make a positive difference in people's health and well-being. Help feed children in need by subscribing to Interview Channel. Your subscription can change lives. We donate a portion of our proceeds to this vital cause. Subscribe and like our videos now, and let's build a brighter future together. Stay tuned for the second question. Question 2. What do you think are the most important skills for a pharmacy assistant? Sample answer. The most crucial skills for a pharmacy assistant include attention to detail, strong communication abilities, organizational skills, basic math proficiency, and the ability to work well under pressure. Additionally, having a good understanding of medical terminology, excellent customer service skills, and the ability to maintain confidentiality are essential in this role. Question 3. How do you ensure accuracy when filling prescriptions? Sample answer. To ensure accuracy, I always follow a systematic approach. This includes carefully reading the prescription, double-checking the medication name, dosage, and instructions, and verifying patient information. I also use barcode scanning when available and perform a final visual check before handing over the medication. If I have any doubts, I don't hesitate to consult with the pharmacist. Question 4. How would you handle a situation where a customer becomes angry about a long wait time? Sample answer. In such a situation, I would remain calm and empathetic. I'd apologize for the inconvenience and explain the reason for the delay if possible. Then, I'd offer an estimated wait time and suggest alternatives if available, such as coming back later or having the prescription delivered. My goal would be to de-escalate the situation while ensuring the customer feels heard and valued. Question 5. Can you explain the importance of maintaining patient confidentiality in a pharmacy setting? Sample answer. Maintaining patient confidentiality is crucial in a pharmacy setting as it protects patients' privacy, builds trust, and complies with legal requirements like HIPAA. It involves not discussing patient information with unauthorized individuals, securing physical and electronic records, and being discreet when interacting with patients. Breaching confidentiality can lead to legal consequences and damage the pharmacy's reputation. Question 6. How do you stay updated on new medications and pharmaceutical trends? Sample answer. To stay informed, I regularly read pharmacy journals and publications, attend relevant webinars or workshops, and follow reputable healthcare websites and social media accounts. I also make it a point to engage in discussions with pharmacists and colleagues to learn from their experiences and insights. Continuous learning is essential in this field, and I'm committed to staying up to date. Question 7. What experience do you have with inventory management? Sample answer. While I'm new to the field, I understand the importance of effective inventory management in a pharmacy. During my training, I learned about stock rotation, expiration date tracking, and maintaining par levels. I'm familiar with the concept of first in first out, FIFO, and eager to learn and implement pharmacy-specific inventory management systems to ensure we always have the right medications in stock. Question 8. How would you handle a situation where you suspect a prescription might be forged? Sample answer. If I suspected a prescription might be forged, I would discreetly alert the pharmacist without confronting the customer directly. I'd document any suspicious elements of the prescription and provide this information to the pharmacist. It's crucial to handle such situations carefully to maintain safety and comply with legal requirements while avoiding false accusations. Question 9. What do you consider to be your greatest strength as it relates to this position? Sample answer. My greatest strength is my attention to detail combined with my ability to work efficiently under pressure. In a pharmacy setting, accuracy is paramount, and I take great care to ensure that every detail is correct when processing prescriptions or managing inventory. At the same time, I understand the fast-paced nature of pharmacy work and can maintain this accuracy even during busy periods. Question 10. How do you prioritize tasks when you have multiple responsibilities to manage? Sample answer. When managing multiple tasks, I first assess their urgency and importance. I prioritize tasks that directly impact patient care, such as filling prescriptions and addressing customer inquiries. I use tools like to-do lists and reminders to stay organized. For recurring tasks, I try to establish efficient routines. If I'm ever unsure about priorities, I don't hesitate to ask the pharmacist or senior staff for guidance. Question 11. Can you describe your experience with pharmacy software or point-of-sale systems? Sample answer. While I'm new to the field and haven't had extensive experience with specific pharmacy software, I'm very comfortable with technology and a quick learner. During my training, I was introduced to basic functions of pharmacy management systems, including prescription processing and inventory tracking. I'm eager to learn and become proficient in whatever systems are used in this pharmacy. Question 12. How would you handle a situation where you made a mistake in filling a prescription? Sample answer. If I realized I made a mistake in filling a prescription, I would immediately inform the pharmacist. I understand the potential serious consequences of medication errors, so I would be transparent about the mistake, no matter how small. I would then assist in correcting the error and participate in any review process to understand how it happened and how to prevent similar mistakes in the future. I believe in learning from errors to improve patient safety. Question 13. What do you know about the different classes of drugs? Sample answer. As a pharmacy assistant, I have a basic understanding of drug classes. These include analgesics for pain relief, antibiotics for bacterial infections, antidepressants for mental health conditions, antihistamines for allergies, and cardiovascular drugs for heart-related issues, among others. I'm familiar with common examples in each class and their general purposes, but I always defer to the pharmacist for detailed information about drug interactions, side effects, or specific usage guidelines. Question 14. How do you ensure effective communication with both customers and healthcare professionals? Sample answer. Effective communication is key in this role. With customers, I use clear, non-technical language to explain medication instructions and answer questions. I practice active listening to ensure I understand their needs or concerns. When communicating with healthcare professionals, I use appropriate medical terminology and ensure all information is accurately conveyed. In both cases, I'm always respectful, concise, and verify understanding to avoid miscommunication. Question 15. What would you do if you noticed a potential drug interaction when processing a prescription? Sample answer. If I noticed a potential drug interaction, I would immediately bring it to the pharmacist's attention. I understand that my role is to support the pharmacist, and they have the expertise to evaluate potential interactions. I would provide them with all relevant information, including the medications involved and any patient history I'm aware of. This proactive approach helps ensure patient safety and allows the pharmacist to make informed decisions. Question 16. How do you handle stressful situations at work? Sample answer. In stressful situations, I try to remain calm and focused. I take a deep breath and prioritize tasks to address the most urgent matters first. I'm not afraid to ask for help when needed, and I communicate clearly with my colleagues to ensure we're working efficiently as a team. After the stressful period, I reflect on what happened to see if there are ways to handle similar situations better in the future. Question 17. Why is teamwork important in a pharmacy setting? Sample answer. Teamwork is crucial in a pharmacy because it ensures efficient operations, reduces errors, and improves patient care. Each team member, from the pharmacist to the assistants, plays a vital role. Good teamwork allows for smooth workflow, especially during busy times. It also creates a supportive environment where we can learn from each other and collectively solve problems. Ultimately, effective teamwork leads to better service for our patients and a more positive work environment. Question 18. How would you contribute to maintaining a clean and organized pharmacy? Sample answer. I understand that cleanliness and organization are critical in a pharmacy setting. I would contribute by regularly cleaning and sanitizing counters, equipment, and public areas. I'd ensure medications are properly stored and organized, making it easier to locate items quickly. I'd also help maintain an organized filing system for prescriptions and other documents. Additionally, I'd be proactive in identifying and addressing any disorganization or cleanliness issues to maintain a professional and efficient workplace. Question 19. What would you do if a customer asked for medical advice? Sample answer. If a customer asked for medical advice, I would politely explain that as a pharmacy assistant, I'm not qualified to provide medical advice. I would offer to connect them with the pharmacist, who can provide professional guidance. For general inquiries about over-the-counter medications or basic health information, I could provide factual information from approved sources, but I would always encourage the customer to speak with the pharmacist or their doctor for specific medical advice. Question 20. How do you handle constructive criticism? Sample answer. I view constructive criticism as an opportunity for growth and improvement. When receiving feedback, I listen attentively, ask questions for clarity if needed, and thank the person for their input. I then reflect on the feedback and develop an action plan to address the areas for improvement. I believe that being open to feedback is essential for professional development, especially in a field like pharmacy where continuous learning is crucial. Question 21. Can you explain the difference between generic and brand name drugs? Sample answer. Generic and brand name drugs contain the same active ingredients and are equally effective. The main differences are in name, appearance, and price. Brand name drugs are developed by pharmaceutical companies and sold under a specific trade name. They're usually more expensive due to research and marketing costs. Generic drugs are copies of brand name drugs whose patents have expired. They're typically much less expensive but equally safe and effective, as they must meet the same FDA standards as brand name drugs. Question 22. How would you handle a situation where you're unsure about how to complete a task? Sample answer. If I'm unsure about how to complete a task, I would first try to find information in any available training materials or standard operating procedures. If I still couldn't find the answer, I wouldn't hesitate to ask a more experienced colleague or pharmacist for guidance. I believe it's better to ask for help than to guess and potentially make a mistake, especially in a pharmacy setting where errors can have serious consequences. I would then make sure to document the correct procedure for future reference. Question 23. What do you think are the biggest challenges facing pharmacy assistants today? Sample answer. I believe some of the biggest challenges for pharmacy assistants include keeping up with rapidly changing medications and healthcare regulations, managing high workloads in increasingly busy pharmacies, and adapting to new technologies and software systems. Additionally, effectively communicating with a diverse patient population and maintaining accuracy while working quickly can be challenging. However, I see these challenges as opportunities for growth and am committed to continuous learning to meet these demands. Question 24. How do you ensure you've understood and accurately captured a doctor's instructions when taking a prescription over the phone? Sample answer. When taking a prescription over the phone, I would use active listening skills and follow a systematic approach. I'd ask the doctor to speak slowly and clearly, and I would repeat back each piece of information to confirm accuracy. This includes the patient's name, medication name, dosage, frequency, and any special instructions. I'd use proper medical terminology and abbreviations, and ask for clarification if anything is unclear. Finally, I'd read back the entire prescription to the doctor for a final confirmation before ending the call. Question 25. Where do you see yourself in 5 years? Sample answer. In 5 years, I see myself having developed a strong foundation in pharmacy operations and patient care. I hope to have expanded my knowledge of medications and healthcare practices, possibly through additional certifications or continued education. I aim to take on more responsibilities within the pharmacy team and perhaps move into a senior pharmacy assistant role. Ultimately, my goal is to continue growing in this field and contributing to improved patient care and pharmacy efficiency. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more videos like this. Share your thoughts and any additional questions you might have in the comments below.